Hello, everybody. I am Sangeeta Sakhrani, the Regional Head of Human Resources for Precious Communications. Precious Communications is a marketing communications agency and its headquarters is in Singapore. So I'd like to welcome all of you to this session today, Why Mental Health Matters. I would also like to thank PRCA Southeast Asia, who has given us this platform to discuss such a vital topic. Mental health has become an immensely important topic that is being discussed not only in our industry, but also worldwide. Everyone faces challenges in life, but it's just that some people can manage it better than others. Some people are more vulnerable and therefore have more of a difficult time managing this. The year 2020 has undoubtedly been one of the most trying times due to COVID-19. And the hybrid of economic and health issues has put a huge strain on people and their resilience to manage their well-being, mentally, emotionally. And given that PR is already a high-stress industry, it's essential that we ensure that our employees are well physically, mentally, and emotionally. So now what I'd like to do is introduce all of you to our speakers. Han Yi is the co-founder of Emerge Performance. And then we have Cheryl Tan, Executive Director of Singapore Mental Health Film Festival. Charu Srivastava is the PR Director at Red Hill. And Joan Loh is the CEO of ThoughtFull. And last but not least, we have Eva Sogbanmu, Head of Communications for APAC at JLL. I will give them a few minutes to just do a quick introduction of themselves and what they do. Thanks.
Thanks, Sangeeta. Sangeeta mentioned, I'm Charu, PR Director at Red Hill, and I guess right at the throes of all that Sangeeta mentioned in terms of the craziness that is a PR agency. I have worked both in Europe as well as in Asia, so I do see some very interesting comparisons in terms of culture and attitudes towards how mental health is treated or even viewed and talked about. So it'll be interesting to kind of share some of those thoughts as we go on with the panel.
Hi everyone, my name is Cheryl and I'm the Executive Director of the Singapore Mental Health Film Festival. And so at the festival, we use films as a catalyst to advocate for mental health wellness. So yeah.
Hi, I'm Eva Sogbanmu. I'm Head of Communications for JLL, which is a big real estate consulting firm in Asia Pacific. I head up a PR team that sits both in Singapore, our regional headquarters, and in markets around the region as well. We have 43,000 employees, many of whom obviously were working from home during the COVID period, but others who had to actually go to work because they manage essential buildings and services. So we have a very interesting employee base, and I'm looking forward to sharing insights as well about sort of mental health issues, not just in this part of the world, but elsewhere like Europe and North America as well.
Hi, good afternoon, everyone. My name is Han Yi. So I run an agency or business called Emerge Performance, where we focus on figuring out how to enable people to thrive under pressure, right, in high stakes environment. And so whether they're athletes, soldiers, and certainly business leaders. So I myself, I'm a performance psychologist, mindfulness instructor, and also executive coach. So I support adults across the different spectrum as to what it means to really thrive, and whether it's called mental health or mental fitness or mental toughness or resilience, all adds up, right? How do we focus on the right things to get the job done? So happy to be here and to learn from each other.
Hi, everyone. My name is Joan Loh, and I'm the founder of ThoughtFull, a digital mental health company. My path to this has been a bit different. So I used to be a banker in Hong Kong for a Wall Street bank for 6 years before coming into the mental health space. Today, what our company does, we actually leverage behavioral science, evidence-based frameworks to really make mental health care more affordable and accessible. So we have an app called ThoughtFull Chat, where we connect users directly to certified mental health professionals for daily bite-sized coaching. And most of the clients that we do work with are either, educational or corporate organizations, and also, consumer clients as well. So very happy that this conversation is happening, and looking forward to your questions.
Thank you, Joan. Thank you, everybody, for doing an introduction of yourselves. So let's just zoom into the importance of mental health. I'm going to direct the first question to Cheryl to answer, and then Joan, you can also share your perspective. In your mind, what is the definition of mental health?
In my mind. So I guess it's unseen. So so I think that's what it really is, right? Mental health is everything that we're sort of like experiencing, what we're feeling, the emotions, the thoughts that go through. So I guess the best definition for mental health that I have right now is to sort of like just take a breath, if everyone is here, to just take a breath and to like for 5 seconds, just sort of like ask yourself, how am I feeling right now? And how are you feeling right now will be sort of like your mental health state at this point. And it's also a lot about just treating yourself with a lot of compassion and like really acknowledging that, you know, whatever that you're feeling, there's no right, there's no wrong. It is just what you're feeling, and that's mental health to me right now.
Yeah, thank you, Cheryl. I think what you said, you know, really makes sense, and there is no judgment. What you're feeling, just acknowledge it, just accept it, and then move from there. So, Joan, what is in your perspective, what would be the definition of mental health?
Yeah. So my perspective is actually very much in line with how the WHO defines mental health as well, because I think they very aptly put it together, right? A lot of times in Asia, people think of mental health not as mental health, but actually mental illness. So the first thing they think about when you say the word mental health in Asia, usually they think of the illness parts, but not the health parts. So it's actually, mental health is actually much more than that. It's not just the absence of the illness, but really it's the ability of an individual to cope with, you know, the daily stresses of life, to work productively, to, you know, have meaningful relationships and live a fulfilling life in the community, whatever it may be. And I think more and more now, you know, again, you know, it's something that in this region we do need to kind of advance a bit more. But mental health is, you know, 3 aspects. It's not just on the medical perspective, or on the other side of that spectrum, you know, the more ephemeral parts of mental health. It's not just that. You do have that biopsychosocial aspect, and they all kind of work in tandem together. So really that's what mental health is. And I hope over the course of this discussion, we'll delve deeper beyond the definition. Yeah.
Thanks, Joan. So, Hani, let me ask, why is mental health becoming a hot topic?
Why is it becoming a hot topic? Because it is an issue. I mean, well, certainly, as we all know, this year there has been significant tremors and changes, right? Socially and even physically, emotionally and economically. So there's been changes, and all this presents as stress triggers. So we as human beings, we go through very significant changes, right? And when we go through that phase, there's disruptions, and some people cope not as well. They are still adapting and adjusting. And so whether it's even physical health and mental health, and they all go hand in hand. So it is becoming an issue. And people are also talking about it more, right? I mean, they're going to their bosses, to their supervisors, and I mean, even from the climate surveys, for example, and the morale and the engagement, they are starting to slowly trend up about, I mean, that this is an issue. We need help. Stress levels are going up, are working longer hours. And so the evidence and the quantitative and even the qualitative data is all coming in here. Yeah. So it's not just a hot topic, it's an important topic.
Yeah, thank you. So, Joan, I'm just going to go back to what you said a little bit earlier about mental health in the region. Compared to the rest of the world, would you say that Southeast Asia has a lack of resources when it comes to supporting mental health? I know they, like you mentioned, that it's viewed differently, but do you think that we also have a lack of resources in this part of the world?
Mm-hmm. I think, first of all, it's important for us to realize that ASEAN as a region itself is diverse. So not all countries within ASEAN is created equal. And as a reflection of that, not all landscapes for mental health is created equal within ASEAN itself. You have countries like Singapore, where we are, that's actually much more ahead of the curve in terms of education, in terms of government investment into mental health. And they've started this conversation, you know, almost 5-6 years ago. And now they are, you know, as PM Lee just came out last weekend on World Mental Health Day, to talk about a tripartite, you know, initiative for mental health. And so you're seeing, as a country, Singapore's already now talking about action phase. This is not the same as, you know, the conversations in Laos, in Cambodia, and to a certain extent Indonesia, Malaysia. It's all quite different. And I think by and large, you know, even for Singapore, by and large, I think in ASEAN as a whole, we are still very nascent in terms of where we are on, you know, mental health advancement. Yes, the conversations have started, and I think it's become louder because of the pandemic, but we're still very far away from implementing that holistic action to engage with our mental health. So I touched upon that biopsychosocial model before. We're very far away from that. And I think there's a lot of work that needs to be done. These are things that are already kind of in place in the US and UK, for example, over the last 10 to 15 years. So yeah, but it's good that we're starting.
Yeah, thanks for that. Eva, since you are not just working in Singapore, but have also worked in other countries in Asia, would you like to add on to anything that Joan just mentioned?
Yes, so I mean, I'm not an expert in the way Joan is, but I certainly have similar observations that I recognize that obviously, particularly with the COVID crisis, there's been an increasing focus on mental health, and that's something that's evident in Singapore, with more resources and more discussion about mental health issues here for sure. You know, I think everybody is aware that mental health is increasingly a problem and an issue as we're all facing these very, very turbulent times. Definitely, you know, as Joan said, in North America and in the UK, for example, it is something that's talked about sort of quite openly, and, you know, just well-known actors and celebrities have been very, very open about their own struggles, which I think obviously sort of helps people to feel able to talk about it more openly. And there's a lot of very, very active mental health charities and not-for-profit organizations in those places as well. But I think there is a lot more clearly awareness and understanding of mental health issues, but perhaps there is still obviously a hesitation in this part of the world to be open about it. And just to share an example from JLL, as I said, we've got a lot of employees, some of whom were working from home, others who were going to work in buildings. And we did actually provide an employee assistance program, which was completely confidential. And it meant that if you're struggling, you have a resource to go to. And each of those resources was locally driven. So, you know, if you're in Singapore, you would speak to a provider completely confidentially in this country. So I think employers can definitely support that by providing that kind of resource that their employees can tap into if they are struggling, particularly at this tough time.
Thank you, Eva. So since mental health is a taboo subject, Charu, in your opinion, how do you think we can break the stigma?
I mean, the easiest way to do that would be to normalize it. So, you know, I think just listening to what everybody has said and adding on is having more talks, you know, having conversations. I mean, the Prime Minister speaking about it definitely brings it a bit more to the front of, you know, people's mind that it's okay to talk about it, because, you know, in an Asian society, we do look at leadership and we take cue from top down. So if the highest you know, leader in the country is talking about it in an open platform, that obviously sets a precedent. And if that trickles down into organizations, you know, from the heads of the companies to team leaders, kind of perpetuating that as well, you know, having open, honest conversations and creating a safe place. So no judgment, but lend a hearing ear to support. So those things really help to break down that stigma. And I think that whole understanding that it's mental health and not just illness. So it's not that if I talk about it, that something's wrong with me. You know, I'm mentally ill or something of that sort. It could just be a state of mind at that particular moment. So that's fine. So I think kind of making that normal would break that stigma. When everyone talks about it, it becomes another thing that is, you know, discussed openly at team meetings or at, you know, company retreats or whatever the platform is, and that creates that kind of normalization of the whole topic.
Yeah, thanks for that, Sharu. I totally agree. Sometimes people are just going through a phase, you know, and then which might last a few weeks. And then sometimes you have people who may be having a more serious problem, which could even last for years. So you're absolutely right. I think we need to look at each person individually and, you know, deal with the problem based on how intense it is for that person. Without judgment, like you said. Cheryl, would you like to add on to what Charu said? Any thoughts?
I think I guess just adding on and kind of like, I'm just sort of like, you know, also what Eva said earlier, being able to, for companies to be able to provide subsidies or providers for employees to go to seek for counseling and see therapeutic help. I think that is really essential at this point right now. I think that's also kind of like, it sort of like chimes into creating a safe and supportive environment. So I think we can all talk about, like, you know, I think definitely in this year, especially, and being that World Mental Health Day just passed, I think this past 2 weeks, I think a lot of celebrities, a lot of people have stepped up to sort of like speak and advocate for mental health awareness. But it really comes down to how each and every one sort of really, how do we still perceive ourselves, and how do we sort of like take to this topic? And if a lot of like, if not just like companies, but also if the government organizations can provide more subsidies for people to access mental health help over here in Singapore and around in the region, I think definitely that will help in the self-stigmatization of mental health. So, and then that would also definitely contribute to a safe and more supportive environment for everyone.
Thank you. Hani, we all have been talking about how COVID-19 has actually accelerated or actually put the mental health issue in the spotlight. In your opinion, do you think it was already there or it has accelerated to a higher degree? What are your thoughts about that?
That's a good question. I think there's sort of two elements to it, right? So I think the seriousness, the pervasiveness of mental health has certainly increased given the significant disruption in the system, right? That has gone up. But also that awareness, right? So that has also gone up as well. So it's almost like, okay, I mean, you buy a red car and then the next thing everywhere you see on the road, there are red cars everywhere. So that awareness has gone up, which is in a way a good thing, right? So that awareness leads to positive action. So I think that is really what we are experiencing right now.
Okay, great. Thanks for that. Given that the PR industry is so fast-paced, do you think that the COVID-19 has increased the stress level of employees? Charu, what are your thoughts on that?
I think it's a fantastic question. And I would say that in a way, yes, definitely it has increased the stresses. And the triggers of that are actually quite interesting. I was actually thinking about this last week, and what I've noticed is, and in my own personal experience as well, is that, you know, we have a false sense of control over time and a false sense of having more time now that, you know, we've been working from home, there's no travel, you know, if you're not in the office, you don't have a small chit chat or like taking little breaks and stuff. So you feel, oh, I've got more time at hand. But then that just translates to you end up doing more and trying to fit in more into that time. So in a way, when I think about it, actually those bits of distractions that we thought of as distractions were good because they forced us to take a break, to literally take a breather, you know, to check in with ourselves and like maybe step away from work and reduce a bit of that constant stress that we feel as we're tackling our work all the time. So in a way, it's been interesting because yes, there is that comfort of I don't have to travel, the stress of that is out of my whole equation of work. But maybe in hindsight, it was actually the time where you get to be just mindlessly stand crammed in an MRT, even if it was just that, but not think about work to an extent. So in a way, I would say yes. So maybe those things were good for us when we were working in a normal time. But obviously, on the other side of the coin is that it helped, because now if I want to go for a run, I don't have to factor in the time that it takes for me to travel back from work and then go out and go for my workout. I can simply just stand up from my desk and be like, okay, now I'm going to go and work out a bit, which helps me with my mental health. So it's a bit of both, I would say, but I think I would lean towards, yes, it has increased it.
Okay, thanks for that. Yeah, lots of plus and minuses. Eva, everybody looks, when you talk about public relations or marketing communications, people always see the agency life as more stressful. But given that you're doing communications in more of a corporate setting, would you agree with what Charu has said, or do you have other thoughts about what she just mentioned?
Yeah, absolutely. So, I mean, I can definitely relate to what you said, Cherry, in terms of agency life, because my background was in PR agencies, and definitely sort of it is high stress, working all hours, pitches, trying to spread yourself across many clients. So the challenges are definitely different in an in-house team. And I think one thing we've noticed is that communications was very much in demand and very central to how we were responding the COVID-19 crisis, because my team takes care of both internal and external comms. So there were a huge amount of demands on us as a team, and we were obviously having to adjust to this strange new working model of basically all being at home. And I speak to colleagues, not just in my team, who kind of say, well, when I'm working from home, I just sort of fall out of bed and straight to the computer with my pajamas on, and then before I know it, it's lunchtime. And that does worry me a little bit, because I think there was a while early on in the sort of process of working from home where people were just working in that sort of unsustainable manner and not carving out time for themselves. And for me personally, the way I've tried to manage it is building in exercise early in the morning before starting the day, rather than just jumping straight into the stresses of the day. And that certainly helped me personally. But, as a team, it's just really about staying connected and making sure that people aren't getting into those habits that perhaps create more stress or just end up kind of robbing them of any personal time, because they're just sort of, dipping into work at all hours of the day and night. So it definitely has increased stress on in-house teams, probably as much as it has, I think, on agency teams. And we definitely have to address that, even though now we're starting to get back into an office setting.
Thanks, Eva. I'm going to go back to what Charu was talking about, how when we're working from home, we actually get time to include a workout because we save on traveling time. But at the same time, you don't get those breaks, maybe like going for lunch with your colleagues and, taking a full 45 minutes or an hour, which actually gives you that downtime where you're actually talking about different things. So I'd like to hear Cheryl's perspective on this and to please elaborate on this part of what Cheryl mentioned.
Well, just before this, I pulled out a statistic. I think the National University of Singapore, they just came out with a survey, and of the people surveyed, 61% of the people who work from home actually felt stressed. So I think, right, like what Eva said, like, you kind of like roll out of bed and you're like checking emails, and it's lunchtime and it's dinner. And then also for those who have families as well, like, you have to deal with managing your children. And I think a lot of like reports came out that, a lot of families, a lot of working adults are realizing that, oh my God, this is what my child does at home. Like, so there definitely has been an increase in stress. And so I think in order for us to create a work-life balance, like what Eva said as well, creating a kind of like a schedule, like a self-care kind of thing for yourself, like before you even start your emails and your routine for work, how do I maintain this sense of like well-being for myself? And yeah.
Thanks. Joan,
sorry, Sangeeta, I was just going to pick up on that really interesting point that you made.
Yes, please.
Yeah, it was just around, obviously, the childcare piece that I think has been obviously a huge thing over the work from home period. And, you know, I think there's been quite a lot of studies in perhaps in other countries or regions about the impact it has on women in particular, but on families in general. So obviously the additional stress outside of the stress of your job, of having to manage all the family pressures as well. And I do think that is something that's obviously having a really big impact on families, but I suspect even more so on women.
Yeah, thanks for adding on to that. I totally agree. I think, you know, when people are working from home and they have to see to their children's school schedules and they're on Zoom and then the parents are on Zoom at the same time, it's really, it can be very chaotic, especially if you don't have your own space. Yeah.
Yep.
Joan, you know, it seems like this COVID-19 and work from home has brought about more stress for people in general, but have you talked to anybody who may have shared that they love working from home and it's working out really, really well? Because I personally have heard some people mention this, they love working from home. So I'd like you to share on that perspective.
Yeah, I think, you know, there are definitely people. I myself actually love working from home, and our company is working from home till the end of the year, because I think that's a certain sense of agency as well, in terms of, you know, how you use your time, how you structure it, and also being able to cut out a lot of unnecessary commutes and things like that, waiting in lines. So I think there are a lot of people who actually kind of like that work-life integration. But it really depends on the demographic, right? So for me, I live with my husband, so it's easy. We have our own workspaces. There are no children around. We're not taking care of our elderly parents. And so it's a conducive environment. And I think by and large, most of the demographic that has shared that they enjoy working from home fall in this category. But I think for those, and this is particularly more, I guess, prevalent in Asia, where the culture is to live with your parents until you're married, and for families to kind of live together. I think, you know, there are a lot of people who are trying to manage that and navigate that, because you're having 3 generations essentially living in one house. You've got the grandkids, you've got the children in the middle, and then you've got the parents who you're also taking care of. And I think all of that kind of adds to the dynamics of working from home. For example, I mean, we know of employees who have 9 people in the house, and, you know, when everyone's kind of working, how many rooms do you have for your Zoom call, you know? And so one of the things we work with our corporate clients a lot and the employees is creating boundaries within physical boundaries and also time boundaries within your work from home routine as well. You know, designate certain areas that are a no work zone. Don't take your laptop to the bed, for example, or, you know, if you're at the dining table, don't bring your phone. You know, if you're only going to be eating for 15 minutes, is it going to, you know, be catastrophic? Perhaps not. So I think that's something that we've actually been working on a lot. We have a market in Malaysia as well, and Malaysia just went into the 2nd wave of lockdown. So this is even more important. Again, I mean, going in, you know, 2nd time, everyone's a little bit more prepared. But I think there is that trepidation of, again, adjusting and making sure that that balance is there. So, yeah.
Yeah, thanks, Joan. You actually touched on things that are related to my next question, which is what would be the 3 top tips for promoting well-being amongst employees? So now I'm going to let Cheryl answer and add on to what you just said.
I think it's also what I said about earlier, like really like Eva's company being able to provide providers and resources for counseling. I think that's definitely very key for top management to do that for the employees. And also what Joan said, to create proper boundaries, like educating your employees on creating proper boundaries, like, you know, and also employers to respect their employees' time and space. Like I've heard so many people, like also who are in the mental health sector, who get calls at like 9 p.m. at night from their bosses and stuff. And that should not be the case. Like whatever that, you know, has to be done can wait till tomorrow as well. So I think being able to respect each other's boundaries and companies like re-educating their employees, and that's really important.
Thanks, Cheryl. So, Charu, as what Cheryl said, it's important to respect boundaries, right? So we might have a great manager who may respect our boundaries, but in agency, we have a lot of clients that can WhatsApp us any time of the day, even at night. So if you were asked, okay, how do we promote well-being and how do we combat things like this or like minimize it? What would your answer be?
That's actually a really good point, and it's actually something that I cover with every new joiner to my team when I sit down with them and orient them with work. And one thing I say is that our time is not our time, because it is dictated by clients and deliverables that are coming through the day. And many times we plan for it, and it just literally goes out the window. So what I do say is make sure that there is like that whole thing about having a very clear guideline as to at 8:30 I stop. Right? Or at 6 o'clock, I stop replying to emails. You might still be reading them, but actioning is a different thing because that takes it to another level of your, mentally being involved in it. Your mind is into the whole thing. And if it is something that's super urgent, we are so well connected, you will be found. If it's something that has to be done today that can't wait for the next day, maybe someone will call you or you'll get a WhatsApp or something. So it's okay to disconnect from most things. I mean, don't go off the grid, but at least take that time for yourself. And it's actually interesting because I had the same question when we started from work from home, because I just felt like it was something subconscious, but I saw myself just sitting at my desk, even after 6 p.m., even after 7 p.m., because it was just so comfortable. I didn't have to commute back home. So I just felt like I could finish what I had on my plate. But it's like a bottomless pit, right? It's like a quicksand. It just sucks you in and you don't realize where the time has gone. So it's good to remind yourself and your team and people around you that take the time off, go away, get your dinner, take your time off, go for a run, whatever it is that you want to do to kind of take a step back from work. A very important thing there. And if there are, I mean, again, technologies, they always say it's a double-edged sword. So if you are getting messages on WhatsApp, and right now it is a time where most clients are on WhatsApp. So, most of us have WhatsApp groups with our clients. But sometimes it's like I said, if it's not urgent, it's okay. You can read it. You don't have to action it. So don't feel that pressure to always be on, essentially. I think that's the bigger struggle. And I think the bigger thing we need to work towards as an agency, that we don't always have to be on. If there is something that's super pressing, don't worry, we will find the person and we will get it actioned out. And I think just on that thing, the other point that I really want to stress is taking a break. So not just like in the day, but take leave. I think one thing people are really shy of is taking leave. There's a sense of, if I'm not there, what happens to my work? Which is wonderful because it shows that you are, very much committed and everything. But to what end? You're not just one person that's running the entire show. That they're teams for a reason. If things are planned properly, it's okay to take breaks, and then your work doesn't suffer as well, so you get a time to recharge. Specifically now during COVID-19, there was a point where no one was taking leave, me included. And I was like, you know what, we need to change this. And it's the other thing that's wired in our head, I think, especially for Singapore, is that if we take leave, we need to travel. So the thought of taking leave and not traveling was like totally unheard of. So it was also, telling the teams that please take time off. There was a point for me personally where I was working on a very, very big project for 2 weeks. And at the end of it, I literally told my manager, and I was like, I'm taking the day off. I cannot come back to work tomorrow and give you my 100% because I'm just totally exhausted. Every part of me is gone, like physically, mentally, emotionally, I'm just spent. And it was amazing. I just literally took 1 day off, and I came back and I feel human again. So I think just not reaching to that point, but also making it okay that if you are at that point, speak to your manager, speak up. It doesn't have to be a big conversation about taking leave. It's okay to take leave. That's why you have leave days. So, take a break, do something that takes you off your mind off work and stuff, and just kind of making that important as a normal thing to do. And I think the other point that's really important is to have an accountability partner. So it might not be someone at work, it could be someone in your personal space, it could be a friend, a partner, a family member who holds you accountable to when you're taking a break. So if you're on leave and you're always on your phone, it defeats the purpose. So if this person can be like, why are you on your phone? Why are you still on emails? Why are you still checking, why are you replying to client requests? Or why are you still, joining your meetings and stuff? So this person keeps you accountable to even take care of yourself. I think we're at a point where everything has to be done very consciously. So subconsciously, we tend to slip back into different types of habits we might have cultivated over the years. So good to keep check of that. And if you can't do it ourselves, which is nothing wrong with it, have someone who's designated to, hold you accountable to taking a break.
Thanks, Charu. I think one thing you mentioned was really important. It's like keeping a check on yourself, being conscious of, not slipping back and being in control of your time and your routine, and being able to, just say no or take a step back and say, okay, I'm not answering emails after this particular time, etc. I think that's so important. You're so right, because I think all of us sometimes just go into this mode where we're just like switched on and we just don't know how to switch off even for a little while. And yeah, it's time, people started doing that actually.
And just to that point, I personally am I'm a terrible person at switching off. So because I see myself struggling, I want to make sure that the people around me, I can preempt them so they don't become to like me, or to the point where I'm like, I need a break, guys. So I think sometimes it's also about using your own experiences and adding it on to people as well. But I mean, that struggle to switch off, especially in an agency environment, is actually very, very difficult. Even if you take time off, it's so easy to just be like tempted to look at that one email or that one message and just always be on, unfortunately. Yeah,
exactly.
Sorry, if I could add on something. So I know we were supposed, as a group, we're supposed to have a meeting yesterday, but I actually took a 1.5-day digital detox. So I actually shut my phone down. I forcefully clicked like quit on my email on all my devices. And so we actually had a lunch this afternoon at 3:15 p.m. as well. And I knew at the back of my head, like, I had to settle a lot of stuff like sponsors, the copy and everything. But I knew that I was on the verge of a breakdown already. Like, like Charu, you said, like, mentally, emotionally, physically, I just felt like super spent, especially after what we did on World Mental Health Day, 4 screenings in a day on Saturday. And so I just knew I had a break. I knew I needed a break, and I knew a lot of people would be like messaging me. So I had a bit of anxiety this morning because I was like, I don't want to switch on my email or my WhatsApp. So I did wake up to like, when I finally switched it on, I had like 150 text messages, and I was like, I'm not replying to anyone just yet. But yes, a full shutdown is possible. And I think it's like sort of like, it's sort of, you have to really force yourself to do it. And it's sort of a discipline as well. But that space in between, like, I definitely feel a lot more human today.
Yeah, that's great. Thanks, Cheryl. Joan, the next question is for you. There is a sharp rise in depression numbers globally. And in fact, WHO has even predicted by 2030, it's going to go up in a much bigger number. How can we identify early signs of depression in our staff? And what do you think are the things we need to look out for so we can actually combat this earlier on in the process?
Mm-hmm. I think that's a great question, especially now. To be honest, it's even harder now to notice these things because we're not physically with that person. So I think at the end of the day, and this is not just for depression, it's really, any form of duress, or be it emotional or mental, that I think people can look out for. So the key is to notice a change in behavior, whether it is through performance, if let's say, you're their manager and you know how they usually perform, and all of a sudden that's dropping off, that's that change in behavior that I think people should be attuned to. A change in, the way they speak, perhaps, which at the end of the day is truly a reflection also of the way they're thinking. And so that change is usually that first red flag, that first sign. Are they, speaking in a more negative tone than before? Are they maybe a bit more agitated than before, a bit quieter, a bit more tired, lack of energy? is this, is this also change in behavior manifesting itself in perhaps interpersonal relationships? Have their, ability to work in a team cohesively been affected? Are there more perhaps troubles communicating, more troubles, even understanding? One of the big things that happens when we are under duress is actually our focus goes out the window, and that can be in that form. So I think it's really important. And again, we do a lot of these things with managers and, those who have direct down reports with them. But honestly, I think it should be for everybody. I think it's very important for everyone to be equipped with even simple psychological first aid, right? Knowing how to look, listen, and link people to the right resources. I mean, can you see these change in behaviors? Are you attuned enough to pick up on these signs? Are you listening to them beyond just what they're saying, but also how they're saying it, why they might be saying certain things? And, have you yourself taken that time to go learn what resources are actually available either within the company or externally, so that you can link them correctly? Because at the end of the day, managers, no matter how senior you are, you're not a certified mental health professional. And there needs to be, and in that as well is where that first aid comes in, right? You need to know when it's beyond your job scope and when, you've done your best and know how to hand it over to the professionals to deal with it. So I think that's probably, one of the best things to look out for any change.
Yeah, thanks. Eva, sorry,
Right.
Tanya, can you add on? Yes, thanks.
Well, being a psychologist, I mean, I think that's also that air of caution, because we have to be careful of slipping into this other spectrum, the other end of overdiagnosis, right? So, I mean, because we the people who are here, they could be decision makers, but they're also people looking for help, right? For decision makers, I mean, the worst case scenario is, well, let's have a checklist, right? So, okay, let's use AI, for example. Let's curate everyone. And okay, you are depressed, you're depressed, you go and seek help, for example. But really, the essence of mental health is connectedness. It's about connecting with people, listening, compassion, relating to people, right? So that should never be taken away. And I think that needs to be factored and considered as we think about how we can support our leaders, our employees through this difficult times.
Yeah, I think empathetic leadership is very important, especially now more than ever, because sometimes it's not about giving the solution or advice, which is very typical for, mentorship or management styles. Sometimes it's literally just being an empathetic leader and knowing how to listen effectively and actually, being there as well. So I totally agree with, not over diagnosis, because sometimes when you become too, what do you call it? Too immersed in a subject, everything will look like a nail that you need to hammer, right? Because then you fall into the other extreme of things. But I think at this stage where we're at in Asia, honestly, we're definitely on the other end of the spectrum where more education needs to be done than not. So yeah, hopefully, we'll get there eventually.
Yeah, thank you both so much for bringing those points up, because I think with COVID-19 and work from home, in fact, we all know the connectedness, the social aspect of things is much less now. And, on one hand, we see that, again, Joan, like what you mentioned, because of demographics, some people work better at home, some people may not. But that is just one aspect. Then you have the social aspect. And if people are not in the office together with their team members or even colleagues from other teams, the bonding aspect gets lesser. And so many things come into play, which we can't see, but is actually happening. So thanks for sharing that. So that brings me to the next question. If, when you're in a company, you have juniors who can be counseled by their managers and managers by senior management. But where can the leaders at the top of the organizational structure go if they could, if their mental health could be a little bit better, or they could be in a better place. You know, they may not necessarily need counseling or things like that, just, you know, some form of better environment. Where can they go, do you think? So Joan, I'll let you continue with that, and then maybe we can have Eva share her perspective as well.
Sure. Thanks for bringing that up. I think that's super pertinent. One thing I would highlight first, though, is that just described a very hierarchical kind of structure. I hope, you know, in this modern day and age, there is some, of course, there's always going to be organization, but there's also a certain level of flatness that can be introduced. That's where the empathetic leadership might come, leading from the middle, maybe, or you know, that the whole leadership servant model, whichever we want. But the other thing as well that I will point out is that everyone should be engaging proactively with their mental health. And you know, it doesn't matter if you're a junior or a middle manager or a senior, there should be things that they're doing, whether in the office or outside of the office, that helps them engage with their mental health. It could be check-ins, it could be journal, whatever it is. There should be things that are done. And I think, you know, the structure that we described perhaps is more akin to mentorship. Perhaps it's more akin to coaching, but probably not on the counseling side, because again, you know, it's beyond that job scope. But I want to pick up on one thing that you brought up as well, Sangeeta, is, you know, not everyone is clinically depressed, and not everyone needs a full-on therapy session. For those, you know, on the call, if you're not familiar with how therapy sessions work, they're usually, you know, 60 to 90 minute kind of sessions with a psychologist or a counselor, and you kind of delve and talk about, you know, whatever you want to talk about. Whereas, you know, coaching might be a little bit different. It could be 60, 90 minutes. It could be, you know, interspersed throughout, you know, the week or the month. And it might not specifically be talking about serious challenge, well, you know, serious in the sense that, you know, you cannot get out of bed, or you can't eat anymore, not that spectrum. It could even be, you know, engaging in terms of, you know, this is an aspect that is, time management is an aspect that's really a roadblock to me living, you know, a more productive life, or a life where I can also make time for myself to de-stress, and that could be something that they talk about as well. I think it's, you know, it's also about engaging with their peers. So for leaders, I think there's a lot that they can learn from their middle managers and from their juniors as well. So it's not like they have to keep on going up and up and up that ladder. That ladder is, you know, it should be completely fluid in an ideal psychologically safe situation, of course. But I think that's where the engagement can happen in many ways. And I think knowing the line between when a manager, you know, can do their mentorship and their coaching, and when it's actually something that I think needs therapy, that's when managers and peers should also start realizing, and that's where the education comes in, I guess.
Yeah, thanks, Joan. Eva, I'd like you to add on to what Joan said, because, you know, you're working in a company that has more than 40,000 employees, and definitely there will be people at the top of the hierarchy, and there must be some kind of structure. This is what I would assume. So I'd like you to share your thoughts on this topic, on this question.
Yeah, I mean, I think in JLL we are trying to be quite open about mental health, and, you know, as I mentioned earlier, offer those kind of assistance programs to those who need it, so it becomes a subject that can be talked about. And I really find it, you know, very interesting to hear from experts like Joan and Hani, sort of their perspectives. I guess, you know, as somebody who's the manager of a team, I recognize that you know, a lot of it is down to your personality. And if you're the kind of person who wants to put a sort of brave face and show that you can sort of tough it through anything, then potentially that will filter down to your team. And I definitely had this recognition that it's important to make it an open dialogue and a culture where people can share. And it's not just about the junior people coming and saying, oh, I'm struggling, can you help me? It's about the manager also opening up and saying, you know what, we're all having a hard time, and you know, personally, I've been really struggling with this. And I think if you can create a kind of culture of openness where as a manager, you can also share the struggles you have and make that an open conversation, then it definitely helps. I don't think it's necessarily always easy. And, you know, if you're a manager who's managing across cultures, that can also be a challenge. But I think the most important thing is to create that atmosphere within your team, and even though it has to be virtually, where you can keep connected and that you have one-on-one conversations where you just talk about how you're feeling rather than, right, you know, let's go through the project work in progress. So that's sort of what I've recognized within my company and the culture that we have.
Thank you, Eva. We mentioned earlier that in this part of the world, people are still not very comfortable talking about mental health, etc. And I think a lot of people still try to put on a brave face so that they don't have to talk about it. But if we were in an organization where these conversations were not happening as much as they should be, if there was a manager who had a team member that was not emotionally okay or had, you know, mentally also were not as productive or not doing as well, how do you think the manager should address this to the rest of the team members? Hani, I'll let you answer that question.
It's interesting that you mentioned that point, because I have a view on this, in that, so we get this sense that people don't want to talk about it because it's a stigma, it is taboo. But I also have a added view to it. Some people don't talk about it because, not only because they don't want to talk about it, actually some of them don't talk about it because they don't know what to say, right? They don't actually have the language, whether it's culture or history. So very simple example, when we ask someone, how are you feeling? What is the most common response they'll say? I'm okay. What does okay mean? Is it good? Is it bad? I mean, and you can tell from the way they say it, okay and okay, there's so much emotional undercurrents in there, right? So even before, so that's something that needs to be addressed, that emotional literacy, right? So that's where the information in terms of communication comes in very important. So last week we actually ran a session where we actually literally had emotions cards, emoticons, and to work with different managers to help them identify, oh, okay, this is how I'm feeling. This is the word to use to describe how I'm feeling, versus just saying it's okay. It's more than okay, right? So these are the words, and so that mapping. So, and to address your point directly, I mean, I think so with that added literacy as a leader, and so that's part of emotional competence as well, and part of leadership, whether it's servant leadership or empathy or courageous leadership, right? And to provide that space for this sort of conversations to happen. That authenticity and of course the psychological safety all come in as well. But of course, I mean, there is that added sensitivities of what to reveal or to say that, okay, this person is having depression or is having a rough time. So giving them the space, for example, Andy is having a rough time, let's give him some space, for example, and sort of let's support each other and work through it, for example. So that's my take, at least in response to your question.
Thanks, Hani. Okay, so based on what you said, I'm going to come to our last question. You said, you know, some people like don't even know what to say, etc. And, you know, I'm going to go even one step further. Maybe sometimes people are, you know, a little bit depressed or in not a good place, and they may not even realize it. And, you know, it's exactly like what Joan said, like you have to look out for the signs, and managers should be able to suss out, okay, is there any change in behavior, etc. Some people wouldn't even realize. So if, let's say, you had a team member or an employee who didn't even realize that they're not doing as well as they could be doing, how can we encourage them to talk about it? Or if it's, you know, a little bit intense, then how do we encourage them to actually seek out professional help? So, Hani, I'll let you, you know, continue with that, and then also maybe Charu can add on, given that, you know, we'd like to also know and hear more about how we would deal with this in the PR industry. So, Hani, please.
Sure. So there's, there's a lot more EAPs around, right? Employee assistance programs, because the question is whether I feel comfortable sharing my sentiments to my my boss, my line manager, for example, because I'm always constantly under appraisal, and if I'm seen to be unable to deliver, is that going to be a problem? Right, so that psychological safety, if it's not there, then there has to be an alternative, and HR can play a part in that, in putting the place, the structure, the processes, and the resources to make avail, and of course communicating this across. So it's a multi-pronged approach, right, to stigmatize, to normalize, and to have ambassadors, for example, and there's a lot of different resources that's available out there. And even coaches and mentorship, as Joan has mentioned. So making those available to employees, I think would be very helpful.
Thanks, Hani. Charu?
Yeah, so I think adding on to that, the whole part about normalizing it and removing the stigma or taboo of speaking about it, and that might lead people to actually self-realize as well, as you said, if they don't even realize it. Maybe bring in coaches, maybe bring in psychologists to have talks that talk about wellness, about managing stress, and start creating that acceptance that if there's something that is a bit off about, how you feel, let's reconsider, is it a bigger issue? Is it something that's a passing thing? Make it a safe environment for them to come out and tell you that actually I want to take time to seek help. Show that they're not going to be penalized. Again, that whole thing about constantly, being under the review, the lens of, are you performing, are you not? So maybe it might be even having some policies that are in place that show that if, we talked about before as a panel, the session, that do we have MCs for mental health? Maybe it's about creating an actual policy that says that if you are having a mental health day, that you want to take some time to yourself to maybe even then take that time to realize whether you need help. Make it all right for that, so kind of create a way where if there is uncertainty, if they even have doubts, that they can come up to you and be like, actually, I do want to take some time off, I want to go seek some help. And maybe they're looking for resources that, as Hanli said, they are resources that many people don't know. Those who are not in the industry, they might not know. So, the things like, ThoughtFull or others that are providing the service, people might not even be aware of these things. So maybe it's about having that kind of a list handy for employees if they think they need help that is not a manager, they need actual professional support. So, kind of creating that environment where it's okay to talk about these things, and just make it a really safe space to discuss, even if it's about asking questions, right? And again, it doesn't have to be you answering it, but at least it's a safe space where people say, is this normal? Should I be worried about this thing that I've seen or noticed? And then that possibly could lead to a realization.
If you don't mind me just jumping in real quick, Charu, I think I couldn't agree more with both, Charu and Hani. I think knowing those resources is so important, and there's so many providers. And Hani, I think you brought up a very good topic on how, sometimes if the providers might be seen to be connected with the employer or be potentially, reporting back to the employer, then of course the employee wouldn't want to go because they don't want it to affect their appraisals. And so, one thing that I think, for example, we always do is to make sure that they know we're a completely different third party, and, not, and nothing, that privacy and confidentiality is always there. But Sangeeta, your question just now about how do we even talk to someone about it? I think, how do we create that psychological safe space? How do we even bring up the topic if it's someone who we work with every day, for example? That's actually more, there's a science behind the art of doing that, I feel. And a lot of it is, I mean, it can be a whole workshop on this, but one of the major points is really to ensure that the tone in which it's done is actually non-judgmental.
Yeah.
I think one of the biggest things that backfires usually when the intentions are always good, but sometimes it backfires because maybe just the phrasing or the structuring of the question could have been perceived as singling them out or victimizing them or putting them on the defense. And so sometimes, there is an art to bringing the topic up, and there is an art to actually asking questions.
Yeah.
And there is an art to creating that perception that, it's, or not even perception, the environment where it's actually non-judgmental, the questions are neutral, the statements are neutral. And sometimes when we use words like, is this normal or not, there is an implication that you're saying they're not normal, which in itself can put a person on defense. And so I think, there are a lot of these considerations that it's always good to, we're talking to the communications industry. I'm sure you guys are the experts. That's definitely in the art of communicating for sure.
Actually, just adding on to that as well, I think those regular checks that you have with your teams then starts creating, it's not like an out of a blue conversation that let's sit down, let's talk about how you've been behaving differently, and creating that, again, putting them on defense. But if you have regular checks and you're always checking in that, are you all right? Are you doing okay? And that is something that we do, with our teams as well. So, we have regular weekly team catch-ups where I like to say that it's 90% us just catching up on each other's lives and 10% work related. And that's a nice way. And we do it on Monday mornings, which is a nice way to start the week as well. But we also have one-on-ones with each other as well. So when you have those regular catch-ups, it makes it okay to ask those questions, right? How are you doing? Are you all right? So it's not like, why are you asking me this question? Did I do something wrong? And am I being like penalized or something that is a bit more that I need to be worried about? It's more like, okay, yeah, it's a normal question because I get asked this all the time, and it's not just me, but everyone in the team is being checked in on. So just creating it, like, again, normalizing check-ins, with your team and making it okay for them to say, actually, I don't feel so good. And then if they say that, then it's already a great way to continue the conversation. I mean, again, not an expert, as Joan said, with the art and the science of doing it, but at least that creates a more mutual opening into going into the topic. And that makes it really safe without having to put the person at like uncomfortable and going like, I'm all right, and going into the whole thing, I'm okay, even if you're not. So yeah.
Yeah, thank you, Charu. I think that pretty much brings us to the end of the session. So I'm going to be taking on some questions. Okay, so this is from an anonymous attendee, and the question is, in the workplace, whose responsibility is it to look after the welfare of the employees? Is it the HR or is it the line managers? So who would like to take up that question?
Well, Sangeeta, you're an HR person, so what's your, how would you answer that?
Okay, I think, in my opinion, and again, of course, there's no right or wrong. I think that because employees are working with their line managers all the time, one would hope, or at least the HR managers would hope, that they would be very comfortable talking to their managers if they had any issues. And they should go to their line managers first. And if they need more help, then they can come to HR. However, if, let's say, a new manager joined and they were not that close to their manager, or if it was something that they want to keep confidential, then they should feel free to come to the HR and address the issue straight away, especially if it's an issue that is quite big. Yeah. Yeah, because I'd like to believe that if you're working with a manager day in, day out, and if it's something where you just need a couple of days off and things like that, you should just be able to go to them straight away. So you can't say, okay, for everything go to HR manager first, or for everything go to the line manager first. I think it would depend on what the issue is.
Yeah, I would add on to that. I mean, my view on that is that everybody has a responsibility, right, including the individual. Right. And so we don't want to get into that, again, that slippery slope of, okay, if I have a problem, it is somebody else's responsibility to help me. And the fact of the matter in terms of mental health is that we actually have tremendous untapped resources at our own disposal. Right. So it's not like I can only be better if someone gives me a hand. No, you can actually help yourself. You can have a lot of amazing, fantastic resources at your disposal. Right. And I think that needs to be acknowledged as well.
I agree. Sorry, I agree with
go ahead.
The points raised. And as a line manager, I think it's actually everyone. It doesn't have to be a line manager or HR. Why just the two? It could be your friend and your peer who you're very comfortable with, maybe someone who you're working with in the industry or in the company, who could then also help support you with that. Maybe they are, going to Sangeeta's point about a new manager, maybe they're not comfortable, but if you speak to the friend of yours, then they can be like, actually, it's fine. You can speak to the manager, or actually HR is great. So I think it goes back to the whole thing of having a community and a support system that kind of, it's not defined. It's not like, it doesn't have to be labeled that welfare is for you and welfare is not for you. Because at the end of the day, we are working together as a big community, as a family for many officers. And it's everyone's responsibility. Everyone plays a part, right? I mean, if you have one rotten apple, it spoils the rest. So if you, same thing, if one person's not taking care of everybody's welfare and your own, it just makes everyone uncomfortable. So then same thing, if you're not, everyone just plays a part in creating that environment that you want to create and work in.
I think Hani brought up a very poignant, aspect here, because let me just frame it this way, right? If you had a diabetes issue, is it the problem? I mean, who's responsible for it? Is it your HR or your line manager? No, at the end of the day, the person who controls what you eat and your sugar levels is you. It's how you manage your diet, how you track your own health progress and all of that. The doctors are there to help you. People, maybe around you, that community around you can help you to maybe, swat your hand away when you're trying to reach in for that chip or that, the candy. But at the end of the day, the person who puts the food in your mouth and affects that sugar level is you. And so I think the same thing, that's in the physical health aspect. The mental health aspect is no different. It is a human condition. We're all accountable for taking care of our own welfare, mental and physical and emotional and spiritual. And HR is there, yes, line managers are there for sure, but we all have that responsibility. And when we take that accountability and everyone does it together, then we can all actually help each other together. So I couldn't agree more, Hani, that it's also very self-driven. Yeah.
Thank
I
you,
just want
Joan.
to add in as well. So because in corporates, like there are a lot of parents who are in corporates, and I think like if parents are the ones taking responsibility of their own mental health, like definitely their children will also follow suit, and their children are going to be the future of the world. So it's kind of like they are just practices that we can carry forth. So because we work with a lot more youth, and we're realizing that just like questions like what Hani said earlier, like you asking, are you okay today? And they're just like flat out silent, right? Because no one knows how to respond to that. So educating the young really starts from like what goes on at home as well.
Thank you, Cheryl. So we'll go to the next question. Oh, this is interesting. I see a few questions, but they're all anonymous attendees. Okay, so the next question is, should it become a necessity for employers to have well-being programs in place to support their employees?
I mean, I can give a comment on this. As working for a company that does have well-being and mental health programs, I think it's a really important benefit to offer. But obviously, each company's circumstances are going to be different. I guess, employee assistance programs are not necessarily within the reach of every company, but I think the least that employers could do is at least put together sort of a list of resources and perhaps have some sort of training for managers in order to be able to recognize when people need help. So I think it really depends on, I guess, the ability of corporates to invest in such things, but I think there should be at least a minimal investment in recognizing that resources are required and how to identify them.
Thank you, Eva. Okay, so we have time for one more question. Okay, so this one is, my peers from the same industry are struggling with mental health. However, they are working under a management who does not advocate or speak about it. To make matters worse, the management is factoring their mental health problems and stress as incapability in their job during their performance review. As a friend, what can I do to assist and help them on this?
Perhaps Yeah, perhaps I can try. Looking at all of you, Hanyi, don't try to run away.
Let you go first.
No, whoever wrote this question, you know, I think firstly, hats off to you because you're such a great friend, and you know, you're actually looking out for your friend, and you're so aware of the root issues that are also going on and affecting your friend. So good on you for being there for him or her. I think this is something that unfortunately is actually quite common, especially in this climate where companies are also looking to downsize. You know, anything could be used as a reason sometimes. It's just the unfortunate truth of business at the end of the day and economics. So your friend is definitely not alone in what they're going through, and I think that there are ways of going around it. When it comes to things like this, perhaps, you know, how I would have that conversation with your friend is, you know, are there things that are within his or her realm of control? And are there things that are beyond their realm of control that can be taken action upon to alleviate the situation? So focusing on whatever is within their control, to what extent, you know, can you as a friend be there for that person to execute and implement and take action on those things that are within control? To what extent are there things that that person perhaps could do on their own? Be it, you know, maybe that person could actually engage with their mental health and maybe, you know, see if the management of the stress and the duress that they're going through and navigating that toxic environment, and just taking care of their health first, is that an option? Can leave be taken to prioritize that for a day, for example? You know, those are things that are within the control, and are also within the policies of work, regardless of how toxic or non-toxic the manager is. You have your annual leaves, you have your medical leaves. Those are things that can be done. And then I think, you know, for things that are beyond your control, at the end of the day, it's also assessing, you know, to what extent is it worth it? To what extent is it connected to ultimately the why of, you know, what you're doing? And I think, you know, sometimes people do not give that credit enough. But at the end of the day, if we are stuck in something that does not drive us, you know, every day to get up to want to do something, then we should ask the question, you know, is it the right fit now for this phase of my life? Or is it, you know, perhaps it was before, is it still? And then we do that assessment from there. But I think these things can be, it's all multidimensional and the dynamics always change. And so always identifying what can be controlled and then breaking that down into actual actionable items. It could be you sitting down with your friend writing those things down, by the way, because sometimes if they're not in that state of mind, what happens when they're talking to you is that it goes in a negative spiral and they just keep on complaining or talking about that same thing, same environment, same toxic situation. But if we take a step back, map it out, draw circles, control, cannot control, and then break it down further for them into bite-sized goals, then it becomes a bit more manageable, less intimidating, less anxiety. And then, you know, hopefully you start chipping at it in a more constructive way.
Thanks, Joan. We just have a question coming from May. So Han, I'm gonna let you answer this one. She's asking, as a new person who is looking for a mental health provider, what kind of areas should we check in on from this provider, or what kind of questions should we ask from this provider?
I feel like Joan would be in a better position to answer this question, right? Because she works with different providers. Yeah. But I mean, from a qualification, so I guess it's a function of qualification and experience, right? So it's not a day fly by night, right? So proper education, because I mean, say psychologists have psychology degrees, and they have relevant work experience, whether it's clinical or relevant work settings. right? So I think those things are quite important. Whether they're supervised, I think that's something that's also very important. So as care providers, right, I think it's important that they are also receiving support. So they're not superhumans, right? So they are also being taking care of themselves so that they can continue to support other people. So those are good questions.
May, if you're completely new to the industry, which I was at some point, some 20 years ago, if we're new to the whole idea of mental health, I think there are three categories of mental health providers. They're all different, and they all kind of serve different purposes. So when we say mental health professional, mental health provider, what does that mean? You have counselors, you have psychologists, and just because you're a psychologist does not mean that they're a psychologist for mental health. There are health psychologists, there are psychologists for children, there are sports psychologists, there are clinical psychologists. Usually clinical psychologists are the ones who look into the more severe cases of mental health. And they are the ones who can do diagnostics and assessments. And then there are also psychiatrists. Psychiatrists are the only ones out of the three mental health professionals who can actually prescribe medication, because they are all trained medical officers, they're all trained doctors who decided to specialize in psychiatric, services. And so they're the ones who will be able to prescribe medication, and that's their main tool in the toolbox. For psychologists, for counselors, they cannot prescribe medication. The toolkits that they have for psychologists, clinical psychologists, for example, is talk therapy, meaning to say, talk therapy, and also assessments and different forms of metrics and measurements. Counselors do a bit less of the measurements, do less of the metrics, but they also do talk therapy. And the types of things that they talk about can be different. So within the realm of talk therapy between psychologists and counselors, usually the individuals will have their own specialization. They will have, certain areas or certain kind of methods. They call it modalities, but really it's just methods that they fall on and use mostly. Of course, I think for you, for someone who's new, they might not know what works best for them. So sometimes it's a bit of a trial and error. We do a lot of triaging because sometimes, a person who, for example, is quite, severely affected in terms of the disruption of their daily life, maybe just a counselor might not be enough. If there are signs of, thoughts of suicide or certain things that are already pretty serious, maybe just a counselor might not be enough. But if it's things like, managing the stress at home, if it's things like, I am finding it hard to stay connected with my work and it's getting me very depressed, those are some of the things, for example, that could be taken on by a counselor. If it's career problems, for example, maybe it might not be a psychologist. Maybe it might be a counselor who does career counseling. So there are a whole bunch. May, if you have any separate conversations, feel free to just drop me a message and we can help to point in the right direction, because it can be a bit overwhelming because there are all these different types of things to look out for. Yeah, hopefully that helps.
Thanks, Joan. Okay, we've just got one question coming, so we will just make this the last question of the day before we wrap up the session. And Eva, please, answer for us. The question is, do you think we'll ever come to the point where mental health is treated like physical health in the workplace and beyond? Not in just how we view it, but also practically, like getting an MC when your serotonin levels are low.
That's definitely an interesting idea. And obviously, I think, physical and mental health are so connected. And if we're talking specifically about workspaces, it's sort of multidimensional. So obviously, I think the biggest impact on your mental health is the people you work with and whether you feel able to connect with them on an interpersonal level, and then feeling that you're part of a sort of welcoming culture within your company. But I think what's often sort of neglected is the actual workplace you're in and its impact on your physical and mental health. And, having a place that's comfortable, has natural light, has space for collaboration and socializing. I think, you know, employers should think a lot more about that in terms of supporting both the physical and mental well-being of their employees. So, I mean, in the long run, I certainly hope that the two things would be seen as just, you know, different sides of the same coin, effectively, because so much of what keeps us healthy physically also supports our mental health, I think.
Thank you, Eva. Thank you so much. And thank you everybody on the panel for, you know, sharing all your insights and answering all the questions. So we're going to wrap up this session for today. And all of us, let's work towards, you know, an environment that provides better mental health and health in general. Yeah. Thank you all so much. And thanks again to PRCA, Southeast Asia also, for giving us this platform to discuss such an important topic. Thank you, everybody.